I'm Susan Dubois. I'm an endocrinologist and I work for community care health centers, and I support this work. Mary and I have been working together for about 10 years now, working with the Texas Drive family. So I'm glad to be here today.
So, can you talk about some tests other than glucose tests that people with diabetes should have, like an eye test or?
Mm-hmm. So there are the annual screenings, and the retinal test is one. So if you have no or mild retinopathy, we recommend that you get some type of a retinal exam once a year. It is most important that you continue to follow up with that if you already have some damage. If you have early retinopathy, sometimes we see that reversed. And in our clinics at community care, we use the iris retinal camera. Mm-hmm. So the patient goes in, they go in a dark room, photos are taken and submitted to an ophthalmologist who reviews them within 24 hours and lets us know. Mm-hmm. If the patient has mild disease, sometimes they'll say bring them back in 6 months for another camera. If there's anything more or anything else that's abnormal, they want to bring them into the office for an exam. Now, the retinal cameras can't diagnose early glaucoma. Sometimes they can see changes that might be consistent with it, but they can't check ocular pressure. They can't look for other diseases. So if a patient is having eye pain or trouble with their vision, they really need to have an in-office exam. And that's a minimum of once a year. If your eye doctor is watching something, you may have to go every month or every 6 weeks, while they're giving treatments. Other tests that we do once a year, we do a urine test for protein. Why do we do that? Because the blood test for kidney function does not become abnormal till you've lost about half of your kidney reserve. I'm going to say that again because that's kind of big, right? Mm-hmm. The blood test doesn't become abnormal until we may have lost half of our kidney function. Mm-hmm. How could that be? Well, we are born with 2 kidneys and people donate a kidney. We know that. Yeah. So we have a reserve. But the problem is this damage from diabetes or high blood pressure or both can start chipping away at that reserve and it can be silent. If someone is spilling protein in the urine, that is a red flag that this is happening, and it allows us to intervene early. Mm-hmm. And what are the interventions that we could use? There's a couple of medications. There's a class called ACE inhibitors, angiotensin converting enzyme inhibitors, angiotensin receptor blockers or ARBs. Those medicines can reduce protein. And then there are a new class of diabetes agents called sodium glucose transport 2 inhibitors or SGLT2. So we can use medications to intervene and reduce the risk of long-term kidney damage. We also talked about eyes, kidneys, we talked about feet.
Yes.
So the foot exam comprehensively in that 4-step way should be done once a year. Mm-hmm. And then other tests are based on patient's age and risk. So if I have a patient who is young and healthy, maybe they have type 1 diabetes, which carries a lower risk for cardiovascular disease early on, mm-hmm. And they have normal kidney function, I might do these tests once a year, a blood test with kidney tests, electrolytes, mm-hmm. Liver tests, and that would be sufficient. But if I have an older person who's on many medications for their blood pressure, maybe a diuretic or water pill, and they have chronic kidney disease, I might need to do a test every 3 months in those folks.
So what do the kidneys do? Why do we need to do a kidney test?
Kidneys are our filtering units that clean our blood. And so we have 2, and they have millions of little nephrons or filtering units. And they filter out toxins, which leave our body through the urine. Mm-hmm. They're also very important because when our blood sugar is high, there's a safety valve to dump that extra sugar. Right. And if you have somebody who develops kidney failure, they could be at risk for developing severely high blood sugar, maybe over 1,000, 1,500 I've seen. And those patients can go into a coma from high blood sugar. So that rarely happens because we have kidneys. Right. And so when the sugar's high, we start drinking water and we pee it out, and that's a good thing.
Okay. Thank you.
Mm-hmm.